someone really is, like, other than what you see on their website?
We look at people and we look at...
You already know me.
Yeah.
But a lot of people don't.
Plastic surgery and what we think about it.
Can I ask one question? What's the name of your podcast?
I'm Dr. Cangello, and I'm a plastic surgeon here in New York City. And this is the first of a series of podcasts that I'm starting. And the reason I've started this podcast is because I think that in the field of plastic surgery, oftentimes patients come in and they're, rather nervous about who they're about to meet and who they're going to choose to have their surgery. And so I thought it would be a good idea to have this podcast, and that way people can sort of get to know me and get to know our practice. And through the podcast, what we'll do is we'll interview, a series of people on different topics in the field of beauty and aesthetics, and hopefully find this very interesting. And today we're going to start with my very first guest. For those of you who don't recognize her face, she would be my wife. Her name is Dr. Tara
Cangello.
And she's a very accomplished woman. She trained in the field of cardiology at both Harvard and Cornell, and she's also a medical journalist. She was a senior medical correspondent at CBS News for around 8 years, and now she's got a similar role at NBC. And so we just wanted to talk a little bit about ourselves and
Plastic surgery.
Plastic surgery, yeah. And what we think about it and our lives, I guess, together, both as doctors, because it can certainly be very busy. We have 2 little girls at home. We live in New York City, and we're sort of back and forth between New York and Connecticut because we have a home out there that we go to on the weekends. And so life at times can be difficult to juggle, but I wanted to hear from us about how we sort of do that.
I'm so excited to be your very first guest on your podcast.
Oh, thank you.
And what does it feel like to be married to a plastic surgeon? But I think that's actually a really good question, because a lot of people would say, like, aren't you worried that, like, he's always looking at all your imperfections and your flaws and he wants to try to fix you? And
I feel like when I meet people often, at a social event or something like that, people often say to me, are you judging at me? Are you looking at me a certain way? And the answer to that question, actually, from my side, is that it's interesting, because I'm certainly not judging people. I think that all of us as humans have sort of a natural sort of instinct. The reality is we look at people and we look at their features, and it doesn't necessarily mean that we're critical of them. But, I think that as a plastic surgeon, there are times when I think to myself, if I do a certain surgery, because particularly we're looking at the face, right? I might think to myself how I might change things or make it a little different, but it's more of an artistic sort of thing for me, because to me this field is art, and I sort of feel like I'm always creating art. So again, it's not from a judgmental standpoint, but it's just kind of like, how can I make something even more beautiful? And I feel like that's a sensitive thing to say, because people might sort of say, well, why do I have to be more beautiful? And it's not about that. Do you understand what I'm sort of saying when I say that?
I do. And I think many people would wonder what it's like to be married to a plastic surgeon, and is he looking at you and noticing every single wrinkle and every single flaw? Right. But I will say, obviously, I've never felt that way around you, which is amazing. And actually, I have to twist your arm if I ever want to get anything done.
See, that goes to show you. So I'm not being judgmental when I do this.
No, in fact, and I will admit, I've had Botox, and the only reason I had it is because my mother called me up after seeing me on television and said that I had these really horrible like wrinkle lines in the middle of my forehead.
Yeah,
she said, you need to get that fixed. You should talk to your husband. So that's when I said to you, can you please just give me a little bit of Botox in the middle of my forehead?
I don't like doing it.
I know you hate doing it, and that's why like I probably get it done like, you know, once or twice a year when I would want it done much more often. But yeah, I think you hate injecting me or doing anything to change me, which is obviously amazing. But you do see or hear about a lot of plastic surgeons' wives that maybe don't look as they used to. But I think one of the things that's so great about you, and not just with me, but with your patients, is that you always make people look really natural, right? You never, ever take someone and make them look unrecognizable. And that's because you're an artist, and I think that's because you recognize like what natural beauty is. And so, and that's such an amazing quality that you have as a plastic surgeon.
Yeah, that's really key for me. I mean, I think that, you know, something that you see so often these days is particularly faces that look unnatural.
Right.
And I think a lot of that comes from, in my opinion, it often comes actually from Botox and fillers, probably more fillers. You know, when it comes to surgery of the face, certainly, you know, people have too many facelifts, that kind of thing. There are surgical procedures that can certainly look unnatural, but, you know, one of the biggest sort of phenomena that we see often is people looking unnatural because they've had too much filler to the face. And this is something that actually you and I do see, and we talk about, because it's...
And I'll ask you what happened
Yeah,
to this
exactly.
person.
And the answer to that is that, you know, when you have filler and you fill so much that you change the natural proportions of the face, that's when people start to look unnatural. And that's something I certainly want to avoid, and, you know, in my patients. And, you know, I think it's something that I want to avoid with you too, because number one, I don't think you need it. And
Thanks,
number,
honey.
yeah, you know, and number two, it's just, you know, I don't think it's very artistic, and I think that everything we do in this field should just be, you know, beautiful and natural and subtle. And that's sort of always been my philosophy with plastic surgery.
Yeah, I think, you know, it's obviously so hard in this era, like with social media and with TV, you know, being on TV, like people are constantly looking at appearances and judging and paying attention to every little thing. And, you know, one of the things that we talk about a lot is we have 2 little girls that we're trying to raise in New York City who have a plastic surgeon as a father. And I think, like, we try to give them really good lessons around like what beauty is and how they're beautiful the way that they are, and how we don't talk about people's appearances actually.
Yeah.
Really, when we watch television, like, we're very cautious about all of that.
Yeah, and it's actually sort of interesting because I don't even know if you know this about me, but on my iPad I have a lot of before and after photos, and I always sort of worry a little bit about the kids seeing them and wondering, you know, because they do ask, you know, Layla especially, the little one, you know, she'll say, what did you do, you know, to this person? And, you know, I always try and sort of formulate an answer that doesn't suggest that I was trying to make an appearance better, you know, because I don't want her to ever feel like she needs to do that to herself. I think that's the biggest sort of concern for me, is that, I mean, as you know, one of the things I do a lot of is rhinoplasty. And, you know, people seek that procedure because they want to feel better about themselves. You know, that's what I firmly believe. And changing the shape of the nose can do that. And, you know, who knows, our kids may end up with larger noses, and I don't want to see them, you know, looking at pictures where someone has a large nose and the first thing they feel when they, you know, get to that age is, oh, I need to change my nose because that's what daddy does. So it is a bit of a tricky thing to sort of, you know, walk around.
Yeah, and I think as a cardiologist, a plastic surgeon, we have a lot of conversations about what a healthy body is.
That's right.
And we use that word a lot with our kids. Like, you have a healthy body that's built to keep you alive and active, and it's not about, you know, exactly what it looks like, and everyone's bodies look different, but the key is to like keep your body working for you for the rest of your life.
That's right, because in you know, we have two daughters,
Right.
one's 7 and one's 11. And the older one is just at that age, where she's playing sports and she's in the locker room with girls and things like that. And, of course, I think they recognize each other in their physiques. And it's, it's just a natural phenomenon that people think about those things. But, what's key is to sort of try and keep it healthy and regulated, especially because I work in this field. You just, I guess my big concern is like having them think that because I do this sort of thing, because I change appearances, that's what they'll need at some point. So that's what concerns me a little bit, I think.
It's a tough line to walk with kids, little kids and girls in particular.
Yeah. Let me ask you a question about yourself. So how did you decide that you wanted to become a cardiologist?
Well, I kind of always knew I wanted to be a doctor from the time I was really little. I was fascinated with science, and if I would be playing with kids at school and one of them fell and bumped their knee, I was the first one there to try to bandage them up. And my family's in medicine. My dad, as you know, is a cardiologist, and I used to go to the hospital with him when I was little and make rounds. And I kind of just knew that this was really my love. So it was there from the very beginning. What about you?
Well, for me, my mom was a nurse, and I think that was a big medical influence certainly for me. I actually had a good friend in grade school, and his father was a gynecologist. So he was the only physician friend, but we knew him very well. We spent a lot of time with them, and I think to some extent there was kind of an indirect influence from him too. But the point is, I knew early on that I wanted to go into medicine. I always had the desire to help people in some way. I sort of gravitated towards science and math and those kind of things, and so from an early time, I knew I wanted to be a doctor and help people. And then it was in 9th grade, actually, that I was taking a zoology class. I grew up in upstate New York, and so it's sort of very country up there. And in that class, we had to dissect these animals, and I was dissecting something, and I was just so into it, and more so than I think the other kids in the class. I think most of the kids in the class were kind of oh, this is fun, and sort of messing around with it, whereas I was literally treating each dissection like I was a doctor and doing it on a person. And literally from that moment, that was 9th grade, I remember saying to myself, I want to do this on humans someday. And so, from an early time, I knew I wanted to be a doctor. But
why plastic surgery?
Yeah. So, I knew I wanted to be a surgeon of some sort, but I always thought I actually wanted to save lives as a surgeon. I never actually really had any interest in plastic surgery. And in fact, when I was sort of younger, I think, and going up through the ranks, I kind of looked at plastic surgeons like, they're not real doctors. And actually, when I trained in surgery, this from being a doctor, that the general surgeons kind of look down on plastic surgeons in a way. They think of them as beauticians.
Right.
In fact, that's what they used to joke with me, is the plastic surgeons are beauticians and not real surgeons. So I started training in general surgery, and I'd actually taken time off between college and medical school. As you know, I went to graduate school, I did research, and so I was a little older when I started my surgery residency. And, I always knew that I wanted to have a family and kids and that kind of thing. And I think I started to think to myself at some point about what lifestyle would look like if I was a general surgeon or something like a transplant surgeon, because I really had an interest in transplant. I did research at Hopkins School of Medicine, and that was in cardiac transplantation. During my surgery residency, my chief resident, when I was an intern, great guy, still friends with him, and we still operate together actually. on occasion. I went to him because I was a little concerned, actually. I was concerned that the general surgeons wouldn't look too highly upon me wanting to possibly switch fields. But I said to him, I said to my friend, I said, you know, I'm not so sure this lifestyle is, you know, cut out for me, and I don't really know what to do. I love being a surgeon. I loved being in the operating room, loved operating. And, you know, he said to me, he said, Dave, you know, what you are so good at is being in the operating room, and you know, your skills in the operating room. And he also knew that I was an artist since I was a kid, and he said, did you ever think about plastic surgery? And I really hadn't before then, but it was so weird because this sort of light went off in my head, and I couldn't believe that I hadn't thought of that actually before.